I'm back with Kirby Craft, and we're continuing to talk about medical records and electronic medical records at our hospital here in Magee. I'm always amazed at how ahead of the game Magee Hospital is. You know, for a hospital our size, we are so progressive and jumping ahead of when something is due. I was interested a little bit more in the security part. Magee does not do. I always think of the hospital and the clinic, you know, but we forget that Magee Hospital owns several clinics. And we have one in Taylorsville and Mize and all around. These clinics all come under the system that Kirby implements. So they are under the medical electronic records, and he's in charge of covering them. I think I got that right. Did I get that right?
You did good.
But I wanted you to tell really a little bit more. I am so interested in the security part because not just working with the website, but, you know, just as an example, last week, Zappo, which is a huge corporation, got hacked. And I got a email from them saying, change all your stuff, change all your stuff. Now, I'm not comparing you to Zappo, don't think that. But it is an encrypted system that somebody got into. But you've got so many things in place to prevent this, and I felt like that our people needed to know.
Well, we put a lot of effort into security. And one of the things that we have done, we've gone to all of our employees and had a similar discussion to this, but FBI recently put some information out that said that they were struggling to keep up with all the security threats that was coming against the American infrastructure. And so as we review some of the directions that they were talking about, and we try to take leads from some of, we try to gather information from broader than just trying to be, okay, we've got an antivirus solution in place. And one of the things that we found is that they recommended that essentially that you try to address these with three things. And obviously the technology, which is one of the things that my group works really hard on, trying to stay ahead of the curve on. We do actually have a number of different technological safeguards. We have hardware firewalls, intrusion prevention, antivirus solutions, a number of different technologies like that. But also, we felt it appropriate to move forward and put processes in place that would protect it. So, as a process at the hospital, we've limited access to any personal devices, personal emails, and those kind of things. And while that might seem extreme, and it is a personal impact to some people, it prevents us from having points of injecting problems or security leaks into our system from a flash drive or from a camera or from a phone or something like that.
I think that's so important because anyone that uses Facebook, it runs tons of viruses. Right. All the time. And you know, you'll see people saying my account got hacked and all this kind of stuff, and I'm very careful with that because of Magee News, but I'm sure really probably the employees didn't like the fact they couldn't access certain things, but it is definitely a safety measure.
Well, it is, and I think people realize that the risk that's out there, and you know, there's an appreciation for the fact that, you know, we want to protect your information because frankly my information and my family's information is in the system too. So I'm very concerned about making sure that security is maintained, and not only because of my family. That's just a core part of what the role that I feel is to try to do that. But I embrace that. It's not just something that we just do, but it's actually something that we completely embrace, and we work to try to bring those different facets in place. So the processes that we put in place is to do that. And then the other thing that we've done is we've actually just asked our employees to just be aware of the fact. You know, if you go to a website and all of a sudden it looks different, maybe it's one that's a legitimate business website, but all of a sudden something looks different, then we don't necessarily need to be going to that site. And I've asked them to just call us and let's validate. If you get an error message or you get prompted for something that you don't usually do. And so it's a team effort that we've expanded out into our entire hospital, asking for help. And the combination of those processes and asking for their help has really been a big plus for our security program.
All right, all these clinics that are around us, the Mize, Taylorsville Clinic, all that, are they under you?
Yes.
I mean, they're under your system. When I say your system, you know, I mean, you're the head honcho with that, but I mean, you oversee all of theirs. All right, can the person who works at the Mize Clinic access something at the Magee Clinic or the Magee Hospital or the...
Well, one of the goals of electronic health records, of course, is to make this information portable. So again, under the guidelines that we're very specific on what people can access and who can access it. But yes, we make that available. For example, if Sharon Scruggs at the Medical Pavilion in Raleigh wants to look up something on one of her patients that's in the hospital, she has access to be able to do that.
That's great.
And you know, if for example, I see Dr. Wade for something, and I go to Medical Pavilion and see Sharon, then she can see what my medical records were with Dr. Wade. So there is some portability of that information within our medical group here.
I think if it just has your medicines, that'd be great. Every time I go there, like, list your medicines, and I'm like, can't remember all that, you know. So
Well,
if they just had my medicines.
It's certainly a direction, and actually, you know, you say that just almost out of, because it's an inconvenience to have to do that, but that is actually a really big problem. And this is one of the things that we're able to do now in both I refer to the clinic because we use a different operating system for the for them than we do for the hospital. But in both of the systems that we have right now, we actually can manage the med list. So that's an important thing, and especially if you get someone that comes into the ER and maybe they're unconscious, maybe the family doesn't really know what they're taking or whatever, to be able to reflect back on that can be life-saving in some situations. I
would think that would be major. What do you see the future? Or you said that in something had to come in place in 2014. Yeah. What is coming next? It's a 3-phase, you said. Where are we heading next?
Well, one of the more interesting things that I have participated in was a conference that was one of the visionaries that was leading this whole electronic health record initiative. And he had been working on this project since the 1960s. And in this effort that he had initiated, he said he had a vision for where we were going with this. And as we think about where we're headed, we're looking for something that you've alluded to several times in your questions, and that is the ability for us to be able to securely access my information from wherever I go in the United States. Let's say, for example, that I go to Colorado and I get sick in Colorado. They don't currently have me in their medical record systems over there, so they wouldn't know what my diseases were, what my medicines were, those kind of things. So the federal government is looking at implementing in stages a health information network where we can exchange information so that we would be able to have a single thread that we could come back and look at specific information about me. Now, there are multiple directions that we're going into with this. The state of Mississippi just this last fall made available, as I understand, their health information exchange or health information network. So this is the first step of trying to work toward a national database of trying to submit that information to. Now, again, one of your concerns and one of my concerns is the security, right? Because when you start talking about spreading that information around, all the conversations and the meetings and conferences that I've been part of, security has been the #1 goal and the #1 discussion in that. And there are standards and business agreements, business associate agreements that have to take place with a number of different groups to protect that information. So those safeguards are being worked in the context of HIPAA, but also in the context of the bigger program that for the public to trust us using those systems, we've got to really protect that data and be able to know that it's secure if we're putting it out there. So that's one of the directions we're heading. And to a completely paperless chart is another direction, so that you don't have to have any paper. You know, some people think that that's probably not likely to happen, but I actually envision that. I see us going there, and actually probably sooner than later. It just makes sense, but because what you want your data is, you don't want data on pieces of paper. You don't want data on a picture or something that was scanned in. You want your data to actually be in the system as what we call discrete data. And that discrete data then can be exchanged more easily, but it also makes things like being able to plot the results of your glucose levels or your PSAs or whatever the case might be. So it makes it a lot easier to just push a button and maybe be able to see those things displayed and trend. And sometimes people are more visual than others. Some people look at a chart, some people look at a graph, and to be able to see those things is just makes healthcare even more efficient in the process.
I tell you, I don't know why anyone would have any doubt about using Magee General Hospital. We are ahead of the game. I admire you. I admire your staff. I appreciate Althea and all that she's done and the vision, you know, to move forward and not stay behind, you know, to go with the technology. So many people look at it as a threat and they don't want, you know, I'm not doing that. I don't want to do that. I'm not getting a computer. I'm not doing this. I'm going to tell you, it doesn't matter whether you'll get one or not, it's there. But I do, and I thank you so much. It's been very interesting, and I appreciate your sharing this information with our listeners. I think that it will give them more confidence in it, and I think it'll give them an understanding And there is no reason not to trust anybody at Magee General Hospital and the clinics that are involved.